Well, hello everyone. My name is Claudia Montoya. I am the founder and owner at Miss Kibbles Natural Pet Supplies. We are a pet retailer. We have two stores, one in Gainesville and Bristol, Virginia. And today we have the pleasure of introducing Dr. Lori Blankenship. She is our holistic veterinarian from Animals First Veterinary Service in Ricksville, Virginia. Um, Dr. Lori, welcome. How are you today?
I'm great, thank you.
And I get asked all the time, who is Chica, aka Miss Kibbles veterinarian? And of course, I can't praise you enough for what you do. And in fact, the way how I found you was through mutual my customers who had shared with me that you saved their dog after being stung by a bee, Suzanne and
Oh,
Larry, with homeopathy. You brought
oh,
their dog back to life.
yes,
So that's how the universe put us back together. And 3 years later, we still have that relationship. And yes,
that's awesome. Homeopathy is one of the main things that I think makes everybody go to holistic medicine because it works very nicely most of the time.
yes. So tell us a little bit more about yourself. Tell us, how did you get started? When did you know that you wanted to pursue veterinary?
Oh my gosh, when I was 9, I think I knew that that's what I needed to do. But I went to graduate school first, or I went to undergrad, but then I went to graduate school and got a PhD in genetic toxicology. Um, and then applied to vet school after I had that. So, um, and during vet school, you really don't get anything holistic. So I didn't know that I would be doing holistic medicine because I studied what like everybody else studied and did vaccines and they teach you about dry food, but you don't get much of anything about homemade food. And then after graduating and realizing that um, that doesn't always work, and is when I started taking classes in different holistic modalities, starting with acupuncture and then
Mhm.
homeopathy and Chinese herbs. And now we do a few other modalities as well, ozone therapy and UV blood therapy. We do a lot of as well. So got a few things going on.
Mhm. So what was that tipping point, that event that year where you're like, okay, there's more to it?
The year I graduated is when I went into the acupuncture class. Yeah, because you see it when you are working in a regular clinic and you see dogs coming and going and not really getting better, because the drugs just suppress their symptoms. And you're realizing that you're not fixing anything, you're just suppressing symptoms for a little while. And then they all just flare back up later. So, yeah, I
Mhm.
wanted to do something different and hopefully fix something for,
Mhm.
for
Yeah.
the long.
So, and is it only, are you practicing currently only on dogs and cats or also horses?
Primarily. I mean, every now and then we get a chicken, or a horse every now and then that we do holistic modalities. There's quite a few equine holistic vets in our area, so I don't do a lot of horses. Um, but yeah, primarily dogs and cats here at the clinic.
Mhm. So as a new patient, how is that visit, that very first visit? When so they come see you, how do you normally lay out that first introduction? Because there's so much to catch up, right?
Right. And so it depends if it's a puppy, we find out what they've had so far and did they get vaccinated, where they came from, and then we talk about how reasonable it is to not vaccinate. And many of our clients come because they don't want to be vaccinated, and we don't push it because we don't want to do it either. Um, so if it's a puppy, we just have a lot of conversations about what's out there, a lot of conversations about food and starting them on the right food, whether they decide to do raw or home cooked or prepared cooked. But we definitely discourage using kibble because it doesn't, that dry food just doesn't nourish them like they need to be. And then we go from there, and depending on what happens. And that's the best place to start to get your long life out of your dog, because if you don't vaccinate him from the beginning, you're starting out with a clean slate and no damage has been done. But if somebody brings an older dog, we have to look at everything that's been done in the past and decide how we can keep them healthy based on what they've had, and how we can change. In almost every case, it's change the diet. Just change the diet in almost every case, and they all get better with diet.
Mhm. So you mentioned titers. For our audience who have not heard about titers, how would you describe what a titers is?
So when you get a vaccine, or your dog gets a vaccine, it's usually a modified live virus or a killed virus, and that makes their body make antibodies to that virus. So a titer is just a test that tells you how many antibodies they have in reaction to the vaccine. So if they have, the levels of titers have been kind of set, what's protective and what's not protective. So we just do the tests and it'll tell us, yes, this dog is protected, has plenty of antibodies towards whatever disease we're testing for, or doesn't have antibodies to it. So that's what that's all about. And it's proof. It's like that is absolute proof of protection, is getting the titer done.
So for a dog that's immunocompromised, whether pancreatitis, IBD, chronic skin conditions, those would you say your candidates for getting titer instead of vaccination?
Yes, and actually we titer everybody, even if they're healthy, mostly because they need that proof for boarding or grooming or what have you, or they just want to know. So we just titer everybody. And I just, after, the only ones that we would really even consider vaccinating would be a puppy. I wouldn't, we wouldn't even vaccinate an older dog. Now, of course, rabies is a little different, right? We have to, because of the law. So, sometimes an older dog will get vaccinated for rabies just because we have to.
So for a pet parent that just simply did not know and comes to you, and let's say they were through the round of vaccines, is there a protocol, or how would you recommend like detoxing the body from the vaccine exposure?
So it depends on what's happening, because if they come and they've had those vaccines, but yet they're pretty healthy still, the biggest thing is changing their diet, or getting them off the dry, right? Getting them off the dry food and getting the protein that they're taking in being healthy meat protein, that is prepared or that is raw, and that will bring them around. It will bring them around. When they have skin conditions because of the vaccines, it's a little different, and I would say every single patient ends up being a little different protocol, as far as trying to fix that problem that was induced by the vaccinations. So we have to just take it case by case and how to fix it.
Right. So you talk a lot about nutrition. So nutrition consultations, is that something part of your services that you offer?
Yes, definitely. We do a lot of nutrition consultation, and we create like specific diets for patients based on either their allergies, or if they have cancer, we want them to have low carbs. So we'll create a diet specific to them. If they're overweight or underweight, we can create a diet specifically to help those issues. So those are most of our diet cases. And gosh, we've done thousands of diets, lots of diets. And I would say that's the best as far as making somebody healthy and getting them back on track.
Yes, definitely. As you know, I'm a fresh feeder advocate. I'm just the middleman when it comes to more in depth, more tailored to the pet. That's when professionals like you come to place, and I strongly encourage them to reach out to you just to cover all the bases. Now, what about supplements? Is that something that you think pets need at an early, more like a proactive, reactive? What are your thoughts on supplements in general?
Well, I can tell you my dogs each, I have three dogs and they all get like 3 or 4 different supplements. So we use a lot of supplements, I would say, and it depends on what's going on, and sometimes the supplements are just to balance the diet, right? Just because they're cooking it or they're feeding it raw, but we need a balance. So sometimes it's as simple as a multivitamin and some calcium and maybe some zinc to just get that balance. Other times, um, they need more vitamin D because we test their vitamin D, especially our cancer dogs. Like they have to have vitamin D. So we test them and we give them D based on their results. Um, Mushrooms, we use a lot of mushrooms for supplements. Mushrooms for cancer, mushrooms for skin, mushrooms even for brain issues, like dogs who are older and have some memory loss, or they aren't acting normal, there's mushrooms for that. um, Other supplements that we use, lots of supplements for heart disease, that are very, very effective. That's about it. I'm sure there's more I'm not thinking of, that's for
Um,
some examples.
like the fish oil, would you say what would be your from
Yeah.
all the supplement categories from probiotics, from joints, skin, fish, mushrooms, CBD, from
Yeah, we do
all the
all of that.
categories out there? What would be
Yeah.
your top three supplements that you say that you think that every pet parent should incorporate early in a pet's diet?
The fish oil, early, because the fish oil helps brain, ear, and eye development. So if the mom dog could go on that, that would be the bonus. But those puppies, when they walk in the door, that's the time, so that you get all of that. It's good to go. So that would be probably my first. Second would be joint supplements, because there are several that are very effective. And we have several on the shelf, and we pick and choose based on what's happening, what kind of joint issue they have. And so that would probably be my second most common. And then third most common supplement probably has to be the mushrooms, because there's just so much variety and reason to do them, and you use different mushrooms for different things. So yeah, those would probably be my top three.
Now, jumping back on the nutrition, allergies, right? We can do an elimination diet, but at the same time, it could also be other environmental factors causing certain allergies. Um, I know last time I saw you, you were bringing in new technology to your practice. Would you like to share more about that?
Yeah. The UV blood therapy, is that what you were thinking? Yeah. So
Yes.
that's actually pretty exciting to me. Um, so UV blood therapy is pretty new. There's only a few vets in the country that do it right now. Um, and it's used for cancer and it's used for autoimmune disease. And it's actually, the original use was bacterial disease. So it's even reasonable to use it for a dog with a bacterial infection, whether or not you're using antibiotics, right? Because there's no resistance to UV blood therapy. So, like there's resistance to antibiotics. Um, the way that it is done is we pull blood. So like 100-pound dog is going to be like 20 cc's of blood. And then we add saline to it. And then we add ozone to the blood, which is O3. And
Mhm.
then we have a machine that has UV. We actually have two machines now. One is UV A, B, and C, and it's got UV lights, and there is a IV line, and we run the blood right through past those lights, and then it goes back into the dog. We put the blood back in the dog. Um, I have cases of mammary cancer where the tumors are shrinking. I have a chronic wound dog that was referred to us by the surgeon who had been working on this dog whose joints basically got very infected, and then they had open wounds for months. it's worked really well for that. They've gotten so much better. And then I have skin disease dogs. I have one dog that only needed 3 treatment, which was pretty dramatic. Um, and she actually, it's been a year, she hasn't had to do anything, and she's had chronic skin disease for her whole life. So that's exciting. And it also treated successfully protein losing nephropathy, which is when dogs lose protein through their kidneys, which
Mhm.
is a sequela to Lyme disease. And it's also an autoimmune disease. So it's an exciting modality to get going with. So
Mhm.
yeah, it
That's
works very,
amazing.
it's pretty good.
Now, so we talk about nutrition and allergies. Now, health comes from the gut, the wonder of the microbiome. Do you have any any testing you do to really see what's happening like in your gut, and how do you address those patients?
So I would say the best test that's out there right now is ran by a company called Animal Biome. And all we need is a stool sample. And they tell us all the bacteria that's in the gut, whether good or bad, what levels they're at, and where they should be, and then how to get them there. So that test has helped so many patients from chronic diarrhea, chronic vomiting cases, skin cases, even, and very commonly skin cases. If you fix that gut, you get much better turnout for allergy cases. So using that
Mhm.
animal biome test has been a game changer for us. It's been a really
Yes.
good
Yeah,
addition.
so last time I saw you, I was sharing, this was my third time testing Chica.
Yeah.
First 2 times that I've done it, balance. This last time she was imbalance. But I actually think it has to do with the brand of food that I'm feeding currently.
Uh-huh.
Um, Before it was fermented, now it isn't. So
Oh,
I just switched her back to fermented, and I'm planning on doing another test next month to see if I can get that gut back to the balance. Not that I'm worried because her poop is just fine, but it's important to know that there is definitely an imbalance happening uh, that I can see.
even the patients who don't have diarrhea, I see some dogs that are completely out of balance. I'm like, well, now we know why we have those other symptoms, but it surprises everybody that even when you do have normal stool, that it can be out of whack.
Yes. And I've been following Dr. Holly Gans, the behind animal biome and all this research and how even behavior is could come from the gut.
Yep.
How you can fix it and how you can help your
Yep.
pet with it. Yes.
Yeah. And it's important because there's nothing worse than a dog that you can't get the behavior right. And yeah, totally.
And then what's mind blowing is the fecal matter transfer capsules they have. How bacteria from a healthy, happy dog can help a dog who's got this imbalance.
Yeah.
Do you find yourself using much the FMTs?
Yeah. We have all the sizes, everything on the shelf because they go out the door every day. And there are some cases you have to do the fecal transfer per rectum. Like if there's a variety of reasons to do a per rectum. Sometimes the dog has a vomiting issue. Sometimes you're just concerned that maybe that capsule landing on the gut isn't going to be the best for the stomach because they've got some stomach issues. So sometimes we do it per rectum in the office where you dissolve the dehydrated fecal material in saline, and then you'd usually then put it per rectum.
Oh,
And
wow,
that,
interesting. Never heard that before.
yeah,
Although I witnessed anal gland expression, so
right.
um, I was like, oh, okay. Mm, interesting. Um, Now, what about? Oh, well, they were also talking about gut health and dental health, because there again, it's all the bacteria that grows in the mouth. Could you
Mhm.
share it with us a little bit more?
So I haven't done much testing on the oral bacteria yet, but I think what we're going to find in the future that every mucocutaneous place, there's bacteria that are supposed to be there, even including the ear. And there is a veterinarian in Massachusetts who I talk to a lot, and I listen to her. She has a lot of podcasts on our site, our alternative medicine site, and she has even done ear transplants, meaning you get the bacteria from the ear of the healthy dog and you put it in the ear of the dog who has an ear infection. And you can do it the same with the mouth. Like if you let the healthy dog drink out of the water bowl and then you take that water and you give it to the unhealthy dog with the bad teeth, then it helps them get their microbiome in their mouth better. Crazy,
Wow,
right?
it
And
is.
they've even done urinary bladder.
Wow.
That's a big step. But she does have cases where they have taken the urine from a healthy dog and put it in the bladder of a dog with a resistant bacterial infection in the bladder and healed the bladder. So, like, the thought of us, we're now healing bacterial infections with bacteria, right?
Okay.
We are. Yeah.
That's amazing.
It's crazy,
And
but to have the right flora is everything. Right? That's what it
yeah,
is. Yeah.
that's awesome. Um, so now jumping on we were talking about the UV blood therapy machine and the ozone therapy in cancer patients. How does all align when well actually sorry, let me rephrase my question. We have cancer. Unfortunately, cancer rates, as we know, it's on the rise. Like I had shared with you, I see an average of at least 2 new customers a week just looking for quality of life at this point for their pet. They just want them to eat. They did the chemo, they did radiation, and unfortunately, it's just a matter of weeks. However, ozone therapy, could you share with us a little bit more, explain to us what it entails and the
So,
success rate?
right, for my cancer patients, we generally do a combination of ozone therapy given rectally and UV blood therapy. So most people who have a cancer dog, they might even buy their own ozone generator because so that way they can give the ozone at home because
Mhm.
you can just do it with rectum. And then they would come in once or twice a week and we would do the UV blood therapy. And then other days they would do the ozone. And then in combination with diet, um, sometimes Chinese herbs, often homeopathy, depending on what kind of cancer it is, what's going on with the dog. We have to support them in every way that we can. But that's how you would do it. And um, if I have somebody who's willing to come 3 days a week for ozone therapy, I think that's awesome. But some people don't want to come 3 days a week and they'll buy their own ozone generator and we'll teach them how to use it and how to do it. And they'll do that per rectum. And that's very good for our cancer patients.
So how long or how do you determine the length of the treatment?
Gosh, it's just case by case by case. So the mammary tumors that we're treating right now is ongoing, and she's been coming since April, and she's come twice a week since April, and we started to get reduction in tumor size in May. So it took us about a month of doing it to get that reduction in tumor size, and now it's significant, quite significant. Yeah. And it hasn't metastasized, which honestly for a mammary tumor, that's big, right? That's a big deal that it hasn't metastasized. Oh,
Nice. It looks like the camera froze on your end,
I see that. Can you hear
but
me?
we can hear you. Maybe he'll come back shortly.
I mean, I haven't touched anything. Do you want me to stop it and start it again?
No, that will disconnect us.
Okay.
That's
But you want me to stop? That's funny.
one moment. But like I said, we can hear you. Let me
Okay.
play around here for just a moment. Um, so on average, how many cancer? What are you seeing these days with cancer?
Oh my goodness. I see as far as what type of cases or um
Yes, what is the common cancer that you're seeing these days?
mast cell tumors, a lot of mast cell tumors. I've got two mammary cancers right now, but I would say I don't generally see that over and over, but we do have two cases that we're working on right now of mammary. Lymphoma, we see a lot of lymphoma and a lot of people who don't want to go for the chemo. That's usually when they come and they don't want to go to get chemotherapy. But
Mhm.
honestly, we can treat them holistically, even if they do go get chemotherapy. And I think if they do get chemotherapy, even especially for lymphoma, what we do on this side of it is even gets them even better. They get even longer. I have one dog who's, gosh, a year and a half into lymphoma, and he did chemo and we did ozone and diet and herbs and other things, and he's actually totally in remission. So
Remind me again, how many years have you been practicing veterinary?
24. Yeah,
And
24.
from let's say 20 years ago to present times, how have you seen that cancer rate from back then to present time? Do you recall seeing that many cancer cases back then?
I would say it is very likely that it is more, but I can't quantify it. But what I can quantify is skin. I see skin all day, every day, meaning allergies, meaning skin disease. And I think that has gotten dramatically worse since I graduated. The other disease that is getting dramatically worse is Cushing's. We used to see Cushing's disease, which is an autoimmune disease when your adrenal glands make too much cortisol. So these dogs are running around with way too much steroid in their system.
Mhm.
We used to see that maybe once every few months. And now I see it every week, all the time, all the time. And that to me is kind of that that is pretty dramatic. I see it.
What do you think could be attributing that?
I don't know. I don't know. I always jump on the I don't know. If it's autoimmune, I'm concerned about two things. I'm concerned about diet and I'm concerned about vaccination because
Right.
there is no doubt that vaccines modulate and change our immune system because they put chemicals in the vaccines to do that. Because when they vaccinate a dog or a person, they want them to be reactive to it. So they use chemicals that makes their immune system react. But that puts us or the dog in a situation where we become reactive to things we shouldn't be, like our food and our environment. And so that's when we get these autoimmune problems.
Mhm.
And I really think if you show me a dog who's never had a shot, never had a vaccine, that dog will not have an autoimmune problem.
Mm.
Just doesn't
In-
exist.
Interesting. Now, tick and fleas and heartworm. What's your again? I know it depends on lifestyle, right? But what's usually your protocol for new patients?
So we use a couple different things for flea and tick, because we don't want to use the poison. So we use a tick tag that is the cat and dog tag, and we also make a flea and tick spray that's made out of essential oils. And that
Mm.
generally gets everybody is everybody's okay on that. If I have a dog that is living really outside most of the time, they might come back to us and say they need something different. In which case, if they really have to have something different, I would use one of the older generation flea and ticks, like Advantage, or Frontline, if I have to. If I really have to and they twist my arm. But you have to know that nothing on the market at all is 100% for ticks. Nothing. It doesn't matter if you use the most poisonous thing on the planet, you're still going to find a tick. And that's the
Mhm.
hardest part for people to understand is like, you're going to find ticks. It doesn't matter. You're going to find them.
Dr. Lori, could you turn the camera off and turn it back on and see if it unfreezes,
Yep.
please?
Okay, now it's off. Oh, okay, it's on. Oh, look at that.
Yay. Thank you
Worked.
so much. So in that note, as you said, nothing is it's 100% effective. The Lyme vaccine, what are your thoughts on that one?
I do not use it because I feel like it is one of those vaccines that modulate the immune system in such a negative way. We have 4 tick diseases out there. We have Lyme, we have anaplasmosis, we have Ehrlichia, and we have Rocky Mountain spotted fever. We have all of them, and we have them all here. And just preventing that Lyme disease is not going to help your dog prevent anything else. And I really feel like in talking to other holistic veterinarians who also are very wary of that Lyme disease vaccine, what they're feeling is that if you give that Lyme with a lepto, or if you give that Lyme with a rabies vaccine, it's even worse. And they're getting sicker dogs very shortly after those shots. So I have chosen to not even carry that vaccine in my clinic. 90% of the time, 99% of the time, if your dog gets Lyme disease, they're not going to get sick, especially if they're fed well and they're not over vaccinated. But bring me a dog who eats dry food and nothing else, and no meat, no real meat, and they get a tick disease, those are the dogs that tend to get sicker.
Yeah, it's
So
setting the immune system for success, and unfortunately, feeding ultra processed diet is not the way to go. And some of the pushback sometimes I get, right, is the cost factor. And I tell customers some is better than none, right? And even if you can't do 100% raw, just add as a topper, right? Or maybe just lunch could be raw and then dinner could be kibble. I know there's many thoughts out there that you shouldn't combine both. I mean, if your dog tolerates it and it's great. But I just don't want pet parents to feel that, hey, I can't afford that. Yeah, and especially now that Dr. Karen Becker and Rodney Habib just launched their book with a ton of recipes. Again, that there's no shame. Now it's the time to start boosting that bowl and adding those fresh foods to the bowl. And I know, again, my pet parents coming to us and be like, well, I told my vet and they were totally against it because I'm harming my dog. And like I explained to them, if you were to go to the grocery store and you buy chicken breast and you plan on feeding that breakfast, dinner, and for the rest of their life, yes, you're going to cause deficiencies because that's not complete and balanced. So it's just trying to break that mentality. And don't get me wrong, I get also I don't like calling customers pet parents. Again, chicken and rice. That's it's great once a week, but not something that you should be feeding on a daily basis. Although with good intentions, it can backfire. Now, I also know that you were behind the formulation of a local raw food brand. Is that correct?
Yeah, we have a brand called Long Ride, and she makes for us. We have a chicken, a beef, and a pork, and raw and in cooked. So we have um, a lot of different options, and we sat down and I had created a diet for her dog, and so we sat down and we put it all together, and so yep, we have that in the office.
Mhm. Now, when it comes to the nutrition, do you do the like go over food energetics with your patients?
Yes, as far as what's cooling, what's drying, what's moistening, what's warming, that's very important for almost every patient to kind of know, where should I be at? Should I be feeding this dog lamb, which is very warming? Should I be going towards turkey and fish, which is cooling, depending on the constitution of the dog? Yeah.
Mhm. Yes.
And every time we make a diet, we take that into consideration. That's important.
Mhm. So we basically done a 360 of what a very first visit is with Dr. Lori, because again, we had this conversation three years ago. It was almost like a full hour first consultation to get to know each other. Yes, it was I feel like finding the right vet is kind of like dating. We've been in Virginia for 8 years. I have gone through a couple of practices. I have had the look of you feed raw, you don't vaccinate. Um, Not that I don't vaccinate, sorry. You titer, what is titer? And just finding you have to find the right vet who respects your views and who's going to work with you. So is there anything you would like to add to our audience and how they can find you?
Oh, we are pretty easy to find. You can find us on the internet at animalsfirstvet.com, and you can see our website that has some more information about the different modalities that we do. And we are available Monday, Tuesday, Thursday, Friday, and our phone number is 540-937-6683 if you want to call, and we have um, um, plenty of people to answer the phone and make you an appointment and answer any questions, because all of our staff, knows what we do and what you might need for an appointment. Yeah.
Mhm. Do you do home consultations?
So at this moment, we don't do many. Like every now and then, if there's somebody close that I have to go to because they can't come here, we'll do one. But most of our appointments are in office. But we do phone consults a lot, because we have a lot of patients who um, have chronic disease and they live, far away, Ohio or Indiana or Florida, whatever. We can do a lot of things over the phone because we can fix things with nutrition and homeopathy when we're doing in that situation.
Mhm. And what about end of life? Do you do those or who do you normally recommend for those calls?
So end of life in the office, they can bring them to us for sure. And usually our office, we have a lot of land behind us, and we usually go outside if it's warm like it is now, and that way the dog doesn't have to be in the clinic, and the owners don't want to be in the clinic, so a lot of times we'll go outside. But at end of life house calls, if they're a client, we'd make every effort if that's what they would like to do it.
So, um, just to wrap it up, what would be your advice for those viewers who just adopted a puppy or rescued a puppy, and they want to do the best they can? What would be your advice? Where do they
uh,
start?
start them out feeding raw if possible. If not possible, then a cooked diet that is fresh food. And I at the moment I wouldn't vaccinate them at all. And of course, as a puppy, you have to keep them safe as far as don't take them to dog parks or anything like that. But the less shots they get, the healthier they will be for a long time. And find someone that will work with you to do all that.
Wonderful. Well, thank you so much for your time. Let me
Thank
see,
you.
let me just check here if we have a couple of questions. Actually, do you mind answering a few questions? Do you have time?
Mhm.
So, Jessica asked, what particular brand of mushrooms do you recommend?
Ah, so we use a couple of different ones, but probably my favorite one is Real Mushrooms, and they're in Canada. But they're pretty good. They have a lot of information on their website. They do a lot of testing, and so that's probably my favorite one.
Then we have Roxy is asking, do you have to give vitamin E when you give fish oil?
Um, Not a lot of fish oils have vitamin E in it already. And if you're feeding a balanced diet anyway, you shouldn't have to do that. When I create a diet, I make sure that there is enough E, but sometimes I have to add it. So it really just depends on the whole picture, the whole diet.
Mhm. What are your thoughts on the flu vaccine?
For dogs,
Mm-hmm.
so I do not carry it. I will not carry it. And that vaccine was created very quickly in response many years ago to some dogs coming here from Asia who had an upper respiratory infection. In this country, no dog died of such infection. And the vaccine company rolled that out as quick as they could. And at this moment, there's no such thing. There's there's no there's no reason for it. It's overkill. It's way too much. So I will not carry it and I will not use it.
So for someone who had to do the flu vaccine because they had to board and it was required, would you say milk thistle would be a good herb to detox or not really?
I mean, Moxisol is always good for detox for anything. But it often depends on what you feel like you've gotten as a reaction. Like if your dog kind of took it in stride and dealt with it, then I don't stress too much about it. Unfortunately, when we give a dog a vaccine, you don't really see a reaction immediately. Like all of these reactions that you see that are allergy related, that are because they modulated the immune system, you're not going to see that the next day or the next week or the next month. You might see it in 3 months that suddenly your dog is allergic to something. And it's because that vaccine changed your immune system, your dog's immune system. And you don't see a change in your immune system as a physical symptom for a while. Does that make sense? So
Mhm.
I think that's why it's taken so long to correlate these autoimmune problems with vaccination, because you don't see symptoms for a while. Does that make sense?
It does. And many goes on there not reported. So
Oh,
then,
yeah, no.
yeah.
But is the occasional dog that you do a vaccine and a week later they're scratching.
Mm-hmm. Yeah. How does ozone work for dogs?
So the molecular mechanism of ozone, so when you put that ozone gas in the rectum, the cells of the rectal wall suck it up immediately, like pull it into the cells, and then it turns to O2, which is oxygen. So it's like a big burst of oxygen for the cells. Crazy,
Mm,
right?
it does. So it's through the rectum. So it's not back on it's not an IV.
So sometimes we do it IV. So we could do it. That's how it works per rectum. So when we put the ozone in the blood, similar. You put it in the blood and then it converts back to O2 because ozone's very volatile, meaning it'll just go boop right back to, not volatile and then it'll catch fire, but it's unstable. That's what I'm looking for. So you put it in in the blood and then boom, it's O2. So now you've just fed all those red blood cells with a boatload of O2. Does that make sense?
Mhm.
But if you just put, you're just not going to put, I guess you could pump O2 into blood, but that doesn't make any sense. You know, you put the O3 in because you want to push the oxygen into the cells.
It's kind of like an atomic bomb to
Goes right
kill
in.
yeah.
Yeah.
Okay. Well, that sums up the questions for today. Dr. Laurie, thank you so much for your time. Really appreciate it. Thank you for everything that you do. And please, I will be posting Dr. Laurie's information on the comment section below, and any as well as her website contact information.
Thank you. All right.
Thank you so much. Enjoy your evening, and we will see you soon.
Thank you. Have a good night.
Thank you.